Hi, my name is Shane O'Connor, and I'm a physical and health educator as well as a medical exercise specialist. And I'm also the co-founder of Integrated Medical Fitness, where our goal is to bridge the gap between healthcare and fitness. I'm here today to talk about lower back pain. Lower back pain is something that affects most Americans. In fact, it affects about 85% of Americans. And if you're one of those people it affects, I'm here to tell you, give you some tips about how to help that lower back pain, as well as explain some of the anatomy, the physiology, and pathology of the area. So if you look over here, what we have is we have a spine. Okay, and the spine is made up of different parts. Over here in the purple, you see the cervical spine. In the green, you see the thoracic spine. And down here, what we have is we have the lumbar spine. This is the area that we're worried about and we're going to talk about today. The lumbar spine is made up of 5 discs. Okay, and you can see here, 1, 2, 3, 4, and 5. And there's a number of structures in there that could be damaged or go through some type of pressure that can cause back pain. All right, and what you have here is you have a smaller model which represents the vertebral body right here. You also have the disc, you have a spinal cord coming right through here, and you have the nerves that are coming out, what we call the foramen. Okay? Now, what we have here, just to give you a little anatomy behind it, what we have here is we have the posterior part of the spine. All right, right here we have the transverse process. All right, we have the superior process, and we have the posterior process. And what this does is it creates a nice little joint here that we call the facet joint. And that just gives you a little anatomy behind it. Now, what we find from an exercise point of view is that the spine is inherently weak. All right, and what you need to do is you need to strengthen the spine, and more importantly, you need to strengthen the structures around it in order to best deal with your lower back pain. Now, I'm going to explain some of those structures. One of the structures, all right, in other words, muscles that I would like to explain is the psoas muscle. As you can see here, it connects from your hip, all right, up to your spine. It's very important in order to stabilize the spine. You have to strengthen that muscle. All right, another muscle is your abdominals. We constantly hear about core training. Core is not just your superficial abdominals. That is just the front of your stomach. It's an important part, but it's not the only part. We need to strengthen the superficial abdominals. We need to strengthen the transverse abdominals, which are underneath the obliques right here. We need to strengthen the quadratus lumbarum, all right, which sits on the lower rib to about your posterior iliac spine. And we need to strengthen something called the spinal erectors, which is postural muscles that go up your spine, the posterior aspect. And we also need to strengthen something called the multifidi, which are your dynamic stabilizers of the spine. They connect to the actual spine and some of the anatomy parts that I explained before. They connect to it, and they're responsible for dynamic stability. Now, what do we go through on a daily basis? We walk around, all right, and we're dealing with things in a dynamic stabilization. All dynamic means is with movement. So as we're walking around, things happen to us. We're lifting, we're carrying, we're pushing. We're doing something we like to call here activities of daily living. All right? And in order to increase the strength of those muscles, we have to work at it. We have to work out. We have to exercise. And I'm here to teach you how and let you know that we have the resources, the staff, the understanding, and the education to deal with all of the things that I just talked about. All right, here we have Amanda Lyons. She's one of our staff members of Integrated Medical Fitness. And what she's going to do is she's going to provide some demonstration of some of the activities and exercises I told you that we were going to do to best help with your low back pain. Now, what this is called phase 1 stabilization. So you're lying in a supine position, in other words, laying down on your back. And what we're going to do is we're going to just take Amanda through some of these exercises, and I'm going to best explain it to you. So the first thing I'm going to ask Amanda to do is find neutral. And now, ladies and gents, okay, what you want to do is you want to make sure that you find neutral. Neutral is the position that is the most comfortable for you. The most comfortable for you. Now, Amanda is a perfectly healthy individual at this point. She doesn't have any low back pain, right? But she can still find the most comfortable position. And typically your back, you don't want it to arch on the ground. Okay, so go ahead, find neutral, Amanda. And she's going to fire up her abs. She's going to squeeze her glutes. And she's going to find neutral. So some of the first things I would tell a client to do is to squeeze the glutes, fire up those abs, just get used to feeling what those muscles feel like in movement. All right, the first thing I'm going to do with Amanda is it's called a pelvic clock. And what I'm going to do is she's going to take her pelvis, and I know you can't see it that well here. I'm going to best describe it to you. All right, so what she's going to do is she's going to take her pelvis. She's going to go towards 12 o'clock. Good. She's going to go toward 3 o'clock without rotating her hips. She's going to go down towards 6 o'clock, and she's going to go towards 9 o'clock. Good. And one more time. Up, to the side, okay, down, and to the side. Excellent, and relax. All right, and so what she did was she started firing up all those muscles that I talked about before. The next exercise that I'm going to do is I'm going to have her move a single arm overhead, followed by another single arm overhead. Now you're going to notice that your backs, as you're doing this, they're going to want to arch. Don't let it arch. Don't let it arch. Fire up those abdominals. Fire up those glutes. Do not let it arch. So go ahead, Amanda. Just bring one. Good. And back down, and then the other. Good. All right, and I'm going to just feel under here, make sure she's not arching. Go ahead, one. Good. And then the other. Good job. And she's doing a great job at firing up those abdominals and those glutes. Good. So, Amanda, what I'm going to ask you to do now is I'm going to ask you to just extend one leg straight out. Good, and then just bring it on back. Okay, make sure that that lower back does not arch. Go ahead, straighten out the other one. Maintaining that neutral position. Good, and then the other. Excellent, and then the other. Good, and we'll do about one more. And then the next. Excellent. Now what I'm going to do is we're going to challenge you a little bit. And this will be the last exercise we're going to do. So the next one we're going to do, you're just going to bring this arm overhead, and you're going to bring the opposite leg out. Okay? So go ahead, opposite leg out. Good, and maintain that neutral. Don't let that back arch. Good, and the other one. Excellent. Good. And we'll do two more, Amanda. Good. Now, there's plenty more of exercises that we do, and what I would do is I would take her through the next phases of stabilization as she progressed towards them. This is how I would start, though. Do not start past this. What I would say is before you start an exercise program, contact your chiropractor, your medical provider, whoever's helping you with this low back pain, all right? And then get cleared for exercise. Here at Integrated Medical Fitness, we will work with your medical provider in order to manage your condition for the best outcome. And we do multiple things here. In this case, this is lower back pain. For more information, please visit us at www.integratedmedicalfitness.com. Again, www.integratedmedicalfitness.com.